So it'll be a 3-hour whirlwind tour.
This meeting is being recorded.
We'll zip through it. There's a lot of slides that you'll get after. And as always, you can let me know if you have any questions. So I am in my Zoom browser because it needed an update and I didn't take time to do that. Can everybody see my screen? Okay, great. Well, let's get rolling. So when I say family, just very briefly, what comes to mind when you hear the word family? Shout them out.
Mom, dad, siblings.
Connection.
Connection. I think I heard connection.
People. Connection. Yes.
Specific people, specific roles.
Support.
Support. It's great. Awesome. So I'll probably say the word family today. And what I actually mean is family very broadly and inclusively defined. And so when you're thinking about family and systems, you know, friends, neighbors, significant other, it's whomever really plays an impactful role in the client's life, especially if they live with them, but not only the people that live with them, anybody who has a strong influence or impact on that person. So why families? Why now? You know, in the 11 years Harry and I have been working at the Best Center, I hear a lot, you know, my role is to talk about complex cases. And so I hear a lot about how families are problematic or they're slowing progress down and things like that. And so, you know, the goal, one of the goals of our ECHO is to really move to more solution-focused discussions and ways of thinking about and approaching cases that involve loved ones or family and natural supports. And, you know, typically we're absolutely thrilled when an individual has supportive and knowledgeable loved ones that are involved, but really this could and should be the norm. And so how do we make this just sort of part of common practice? I don't know about all of you, I'm a psychologist by trade and my area was family, but outside of that, unless you worked with kiddos, you know, that it was sort of a client-centric perspective. And so how do we kind of break out of those training habits that are sort of implicit in our work and how things are billed in the state of Ohio? And so we'll be talking about some of that. So loved ones can really be a help to our work or a hindrance, but much of that is determined by us as providers because loved ones really do need a roadmap. You know, it shouldn't be this kind of push and pull antagonistic relationship. It shouldn't be we're on total opposite sides of the playing field, you know, and there's a big gap between where we're at and where they're at. It's us, you know, figuring out ways to align with their needs and their wants and their goals, and then helping them figure out a way, you know, to get to where they're going and how can they really be supportive with the client along the way? What are some of the pit stops? What are the safety nets? And so we can kind of be their tour guide along this mental health journey. So just to touch on research is we know that when knowledgeable and supportive families are engaged in treatment, outcomes improve, and not just outcomes for the individual, but outcomes for the whole family system. And this has been documented for many, many years. You know, family psychoeducation is an evidence-based practice that's been around since the early 80s. The schizophrenia patient outcomes research team, which I think you all have probably heard about with Harry, that provide recommendations and guidelines for individuals living with schizophrenia spectrum disorders. One recommendation that's always been present is to really provide family-based services, you know, evidence-based practice, longer-term interventions when possible. But even short-term interventions, 4 sessions in less than 6 months, can still make an impact on that system. And not to mention, it helps to make our work a little bit easier. If we have extra set of eyes and ears out there, if we have individuals who are knowledgeable about what's going on, what our treatment plan is, the work that we're trying to do, and they can really encourage and support that work rather than unintentionally working against it. So when we're thinking about systems-based case formulation, where do we really start? You know, truly it's thinking about all cases in a systemic way. So when we're conceptualizing a case, we have to consider that person within a larger system because nobody lives sort of in a vacuum. And so who is consistently around that person who plays an important role in their lives? And it's not just the impact of the system on the client, but also how is that client impacting the system? You know, what is this bi-directional or reciprocal relationship? And how is it contributing to mental health and wellness? And how might it be setting things back a bit or contributing to symptoms? And so, you know, figuring that out is very, very critical with all of our cases. When we're thinking systemically and thinking, you know, formulating a case, it's important to consider the beliefs, the values, how people identify roles within that system, the culture, trauma, religion, all of these life experiences And again, not just of the individual, because these things may be very different for the rest of their system. And again, what is the impact back and forth? And if we don't have that information about that system, we may be making clinical recommendations in, well-intentioned recommendations. However, if we really don't know the belief system or the cultural values of that system with whom they live or who makes a big impact on their lives, we can be creating some unintentional tension or friction with the team and the family system, but also for the client. If we make a medication recommendation and the family's culture does not believe in medications and we don't know that, we can't have those discussions early on before making recommendations. And that can really feel dismissive to a family and create an uphill battle and create a lot of tension for the client because they don't know, should I take the medication and be the quote good client, or, should I skip the medication, say I'm taking it just because I don't want to upset my family system. So important things to think about. Identifying those goals and needs that I mentioned, most loved ones want to be heard, they want to be understood, they want to be helped, but they also want to be a part of our team. And they really want to be of help to the client and to the team. But the only way to know what they really want and what they really need or what their goals are is by asking them. And, there's that common saying of meet the client where they're at. The same is true of family systems. But it's very, very important to be thinking about how we can align their goals, needs, and values with the work of the client, and also with the rest of the team. And sometimes this, boils down to finding the smallest nugget of common ground. We may be on different sides of, belief systems about mental illness is real or medication is useful. But the one thing we can always all agree upon, the client, the system, excuse me, and the treatment team, is that we want health, wellness, and happiness for the client. And so if that's our place to start and that's all we've got to work with, at least it's something. And I think it's important to just remind ourselves of that. Excuse me. So one of the things that we think about when we're talking about clients is really about engagement. So, how do we engage the client? How do we maintain engagement? The same is true for family systems, and each one is unique. So when we're thinking about engagement of a family system, does this fit their current needs and abilities and capacity? Or do we have to modify that definition for that family for this particular point in time? What are the barriers or the roadblocks that are stopping them from engagement? What really helps them engage? Maybe it's us giving them a call, making sure that they're doing well, checking in with them. Has their engagement changed over time? What worked in the past? What didn't work so well? And also related to this is discussing expectations. So expectations of all involved. So expectations that they have of themselves, of the client, of the treatment team, of the mental health system, of one another, as well as our expectations and the team's expectations. Is the family aware that this is what we're hoping for? That they'll bring them to appointments, they'll ensure they take medication. And we have to be careful not to place families in dual roles where they are torn between, making sure they take their medication, but this leads to frustration and tension, and it's causing conflict between mother and son. It's always a family first or, loved one first perspective. And so we have to problem solve with them. If our expectation is the person needs to take medication and this isn't a good fit for mom to be checking in, then that's something that we need to problem solve with the client and with their family system. When I think about engagement and facilitating engagement, I always think about taking a stepwise approach. So sort of step one is figuring out the who supports the client, and really avoiding the use of the word family, because people get stuck in that cognitive set and they struggle to get out of the idea of blood relatives and they may not have a good relationship. It's also how we frame our questions. So, who do you call if you're having a rough day, if you're feeling kind of down and out, or if there was an emergency? If they say no one, who do you wish you could call, or who did you used to call, to do some of that exploring? Who do you call if you're having a great day and you have great news to share? But also, who calls you? And I think that's a question that we don't ask nearly often enough. So who calls you if they're having a rough day? Who calls you if there was an emergency? Who calls you to share, happy news? And if the answer is nobody really calls me anymore, that's a place to, again, explore. And so I just want to put a teaser in: the recovery-oriented decisions for relative support, the reorder approach, we'll talk about in an upcoming didactic in a couple of months, I think. But this is a great kind of low-hanging fruit to talk with clients about, their thoughts about involving supportive loved ones. What are their hesitations? What may go well, may not go so well? What concerns might they have? What are the potential benefits? And so this kind of the reorder approach is a great lead-in that provides some structure to having these conversations. So once you know the who, and we've talked about what it may be like to involve that supportive person, once we get the go ahead from the client, that's when we can reach out to families and attempt to engage them, provide some information, and also provide support, not just in their support of the client, but also support for themselves, making sure that the system is healthy so that the client has the opportunity for health. Just to, a note about the importance of safety first. So when you're thinking about involving family systems, doing our due diligence to make sure there are no orders of protection, history of domestic violence, considering how the family communicates, how they argue, how often does this happen, how often does it escalate to something big, to something physical, and is there a lot of expressed emotion happening? So hostility, criticalness. Are they emotionally over involved? So something to always keep in the back of your mind to make sure that you kind of do your checks and balances with the client and the potential family members that you're going to engage before bringing them together. So, when we're providing that support to families, we also want to make sure that they understand that they have a role to play in treatment. And so, it's not just that you're their transportation or you make sure that they take medication. It's not just that you drop them off and, we can make things better. It's really that they truly have a role to play, in communication, in working with the client, in changing language, and all of these kinds of things. If they understand that there are things that they can do, that's really an empowering and hopeful position to put families in. And they often don't recognize that. And so it's important that they understand what that role looks like and that it changes over time based on how the client is doing. Sometimes they have to step in a bit more. Sometimes they have to step out a little bit. So, just consider how might loved ones actively participate in sessions, where you're doing CBTP work. And we'll talk about that obviously throughout the ECHO. And also, when you're formulating or conceptualizing your case, thinking about what are the critical things to be listening for or asking about so that you can approach it from a systems perspective. And so I just noted a couple of things in here. How interested and open is the client to involving loved ones? In what ways or at what level are families open to engaging with the client and with the treatment team, figuring out what their belief system is, what their needs, goals, and values are. And there's, I noted in yellow, some great little activities that we'll touch on throughout the ECHO that can really help you with each of these items. Like the value card sort, you all are probably familiar with that. That's a great exercise to do with individuals. And even more exciting one and even better one to do with families. I absolutely love this activity for family systems. What's the impact of the illness on the system? What's the impact on the system, for the client and the illness trajectory? And where do you want to go next? What's the action plan, not just for the client, but really considering that full system and how that family can interact with the treatment team. Other things are levels of acceptance or understanding of the illness. Are there other young family members in the home, either children of the client or siblings of the client? What's the role of trauma or substance use? Is there levels of acculturation that may differ within a family system? So different things that you can consider as you're thinking about a case. So just some things to have in the back of your mind. There's a great little practical approach to starting some of these discussions. And it's called the CITS, and we'll be sure to send you the handouts for this. But it's a 15-week family focused protocol. But really, I like to highlight in this context handout 2, which talks about what does family mean to you? What does your role look like in the family? Are you satisfied with this role? How do you contribute to the family? How does everybody else contribute? What are your thoughts about your mom's role in the family? Is she the peacekeeper versus your dad, who's the breadwinner? Or whatever it may be. What does your ideal family look like? How might you get there? So it just offers some discussion points or prompts that you can use. And so we'll make sure to send that. But again, it's a great way to get information to help you formulate a case from a systems perspective. Just a couple of updates, just to make sure that you all know, in the state of Ohio, we now have a billable service for family peer support specialists. through NAMI Ohio and OMAS. And so if your agency has peer support specialists, this is an additional supportive service that you can offer, and it is a billable service through Medicare and Medicaid. And if you have any questions or want more information about family peers, please let me know. I'd be happy to share that with you. Also, Harry and I were talking the other day, CE time is winding down and we're trying to get stuff in under the wire. And so there is a course that just expands on what we talked about today that is free, and you can get 2 CEs. It's a 2-part course through the eBased Academy. So if you're interested in hearing a little bit more about what we talked about today, you can get 2 free CEs, and that'll help you for licensure. And then I included a couple other resources that you can share with family members whom you may be working with. And excitingly, NAMI's first book is going to be coming out. It's You Are Not Alone. It's really a guide about how to navigate mental health, because I think this is one of the biggest struggles, and it's something that really isn't out there yet. And so just wanted to include a couple highlights about that. All right, I think that's all we've got. Any